Great. We have Yiping here with us.
Oh, yay.
Great to see you, Yiping. You're on mute now.
Can you hear?
Yes, we can hear you.
Okay.
Okay. Okay, so let me officially start this first Dawn talk on COVID-19. My name is Maria Gracia Cuervo. I'm Dawn's General Co-Coordinator. My guess is that if you're here, you have heard about Dawn something, but if not, let me briefly tell you that Dawn is a Global South feminist organization, and the main focus of our work is to do analysis, research, and advocacy for economic, ecological, and gender justice. So we've been doing this work for a long time. We are very honored to have today with us one of our board members, who's Claire Slatter from Fiji. I'm going to give a short introduction in a moment, and our main speaker, who's Kai Yiping. As all of you have experienced, the impacts of COVID-19 have been terrible for the whole world. We have felt that for the past 3 months, but in China and other Asian countries, it's been even longer, almost 6 months in China now. And well, the whole world has experienced this terrible impact. In the Global South, it's been worse as usual. And it has deepened pre-existent inequalities, and it has shown vulnerabilities in our economic, social, and political systems. So we wanted to develop these talks with Dawn members who can share their experience from the ground, from a Global South perspective. And this is what we're doing today, and we're starting with no other than China. We have with us Kai Yiping, who's a Chinese feminist. She's been with Dawn involved in regional and global advocacy for many years now, and she's also a Chinese researcher and journalist working with local feminist organizations and research institutions. And Kai will be, Yiping, sorry, will be sharing this talk with Claire Slatter, who's a Fijian feminist scholar with a background in anti-nuclear, anti-colonial, and trade union activism. And she's, as I said, Dawn founding member. She's been involved in regional and global advocacy and research with us as well. So just to give a general guidance on how this will go, Yiping and Claire will discuss Yiping's experience from the ground and also from traveling during the pandemic, and how has that been experienced for a Chinese national for about 40 minutes, 45, and we have the audio for participants muted for the time being, but you can please use the chat. You can post questions during their talk. We'll be monitoring the chat. Please introduce yourself in the chat. Just write your name and where you're coming from, and you can then write your comment or question. And have half an hour, a bit more, if time allows, to discuss your questions. We'll try to cover as many as we can, but perhaps not all of them. We won't have time for all of them. So with no further ado, Claire Yiping, you have the floor.
Hello, I just have to check that my mic is not muted. Can you hear me? Yeah, okay.
Yes.
Yeah, thank you. Just let me join Maria Graciela in welcoming everybody to this first of our webinars, and to thank Yiping for agreeing to be the first participant in this, and I'm very honored to be sharing the spot with you, Yiping. So it's going to run like a conversation. Let's start without any further ado, because we've lost a little bit of time, Yiping, in your work and engagements as a national, regional and global advocate, feminist advocate on policies, you travel a lot, both inside China and abroad. Where were you when the outbreak in Wuhan of what subsequently became a global coronavirus pandemic occurred? And how did you first learn about it? And what was your, or were your initial reactions or responses?
First of all, let me also share my, excitement to see so many friends and colleagues in this event, even though we cannot.
Yiping, we lost your audio. Something happened and we cannot hear you anymore.
You can't hear me.
Now we can hear
Now we
you.
can.
Sorry.
Can you hear now?
Yes,
Yep.
perfect. Thank you.
Hello?
Yes.
You can hear?
Yes. Yes.
I can hear Claire now, but
Yes.
I can see that you're nodding. Okay. All right. So I think talking about, the travel, maybe that's the last thing you want to do during, this pandemic is to travel. However, when this broke out, I was traveling inside China, attending a meeting on the gender and development. And also I travel for other meeting in the region and in Bangkok, without knowing anything about, what's going on in Wuhan. There was an occasion like news about, there's a disease, there's unknown disease, but it's under control. So we're just living a life like normal. Until one day, there was officially announced, this is a very serious, epidemic. So people are shocked. I was also among those, the people that feel shocked because, this must have been already around for, for 1 month, so, for 1 month at least, that without, understand, how serious it was. Of course, at that time, even we were shocked by the outbreak of the epidemic. We're now even more shocked actually now after we heard that is that becoming a global pandemic. At that time, I think the information that we got is through the social media, like, Chinese social media we use frequently is the WeChat. There's information and exchange in the social media network. However, there was not consistent with what the official news that we usually heard from established mainstream media. I think that's the inconsistency. Consistency. This is a lack of transparency and information. Make people very frustrated and angry, when this official announcement was made on the January 19, 2020. That's what already, and just a few days later, it was announced that Wuhan is totally locked down. So, and this is during the very sensitive time because this is a Chinese New Year, festival. Usually that's our time to celebration, enjoy life with our friends, with our family, but that's a very unusual experience, I think, and everyone in the country feel shocked. Yeah, so that I feel like, that from that moment on, from that day, I think our life have totally changed up to now. Because the next day I was board on the train to go to see my parents in another city, my hometown. And on that train, everyone wear masks. And I couldn't see many passengers and I didn't see many pedestrians, on the street, very few traffic, no cars. At that time, there was no lockdown. There was no a quarantine, no nothing. It just announced this news that already make people scared and take some precautions. So this is how I feel, when the people said, oh, people are very, submissive, they're obedient. No, I think people just take precaution not out of the, this obedience or anything like of, energy to resistance. It's out of the fear. It's very, common human feelings, the fear of the, this, the virus, and the, the precaution that taken is trying to protect themselves and protect their loved ones. So it's just as simple like that. Yeah, so that's how I feel like. I feel like, wow, there was a totally different from now on. We enter a new era. Yeah, so that's the moment of shock.
That's very interesting, Yiping. And
I can't hear you. It's like Claire.
Claire, oh dear. Let me just see. Oh, mute. Can you hear me now? Can you hear me now? Oh goodness. Sorry, can you hear me? No?
I do hear you, Claire.
Okay, only Yiping can't hear me. She needs to hear me too.
Hey, maybe we need some help, technical help.
Her mic is unmuted, so she should be able to.
Hello?
Yes.
Yeah.
Do you hear me, Yiping?
Hello?
Hello? Hello?
No.
I can hear you. Can you hear me, Yiping? No. Oh goodness.
No, Claire.
No. Well, my mic is unmuted.
Oh, okay. I cannot hear.
You can hear me now?
I think we're experiencing a little issues with your connection, Yiping.
You want to write down your question instead of talk?
Okay, but it's actually quite a long question. Okay, yeah.
I can type it for you, Claire.
Okay, all right, while I talk, yeah. Basically, I was going to say that, quite clearly, people in China registered how serious this was. And that's why they were quick to react with, taking precautions. But also, I wanted to say that, China was really under the microscope throughout the world. We were watching what was happening in China following the Wuhan outbreak. And we were watching not just through our TV screens and through the news and coverage of what was happening.
So let me, maybe I should log off and then re-log on. Let me try.
Okay.
Yes, that's what I plan to do.
Thank you for your patience, everyone. It's not so easy for Yiping, especially being in China, to access so many of these platforms. So yeah, we'll just try to sort it as we go. And thank you, Claire, too.
That's okay. Sorry, if everyone else can hear me, I was saying that, it was clear that people had recognized that this was really a very serious epidemic. Can you hear me? Yes. Okay, so let me continue. I was saying that, people recognized that this was a very serious outbreak of this viral outbreak was very serious. So they were taking those precautions, as you pointed out. But also the whole world was basically focused on looking at what was happening in China. It dominated the news, and we were following, what the government was doing and so forth. And it wasn't just that we were following the news through our televisions. We were actually being bombarded, if you like, in social media or through social media of all kinds of stories and film footage. And some of the footage, for instance, showing people who were suspected of being infected by the virus or suspected of being exposed to the virus, being barricaded in their houses. And this footage was quite disturbing from a human rights perspective. So, you know, the questions that I'm asking is, was that fake news, or was some of that really happening? And was there any public concern about what was seen as a heavy-handed approach by the Chinese government in managing this health crisis, or this, public health crisis, by enforcing stringent containment measures across the country, controlling people's movements and bringing the economy to a standstill? Because all of these sweeping measures must not have been seen before. Yeah, so.
Right.
If you heard.
Yeah. Yes. Yeah, I think this is a really the new challenge. You know, as I said, the people are shocking. I think the same with the policymaker. They are shocking. I think one reason why they didn't take an effective measure, you know, at the first, when they started, is because they didn't know. They have so little knowledge, so little sensitivities and information maybe to analyze, to assess, you know, what measures should be done, also the attitude, the latitude of the, you know, the severeness of this crisis was beyond the imagination. I think even now. So, you know, when you're shocked that you're like disabled, you're unable to do anything, you know, not really acting effectively. I think that's what's happening at the beginning. And I would have to say that it's also because of the lack of transparency and trust, in the lack of, you know, the information. That's why some of those, you know, shocking footage go viral in the internet. And people, when there's no reliable source of information, you know, you just turn to anything that you want to believe, you know, because that's also somehow reflected, you know, the horrifying, you know, that kind of situation that you're now undergoing. So yeah, I think those measures it's taken at the beginning was, of course, one is that maybe not as quickly as it should, and also not have a comprehensive, like, you know, when there's a problem here and you're trying to fix this problem, but without thinking, you know, holistically, the other measure need to be taken, you know, at the same time, simultaneously, because this is a systematic, you know, crisis, not only one single problem that you can easily fix by taking, you know, some quick, you know, fix measure. So that's what happened. Like, for example, if you lock down, if you implement, you know, enforce lockdown, you have to think about the livelihood of people, you know, the life, and also the people who are not able to, you know, to implement this, you know, like either they are now on, you know, on the way, that they were, when you lock down, you know, they cannot go home. So the people like, for example, the, you know, people in Wuhan, that, as I said, they would visit their relatives and families in elsewhere in other province, they were rejected. You know, they were like, you know, like they were rejected by the people like a virus, like, oh, they're contaminating, you know, so that they're not able to, you know, book hotel. They're not able to find the lodging and accommodation. You know, even in the highway, you know, they're not able to have a rest in those, you know, the resting area. So that's the people were only think about lockdown of Wuhan, but you didn't think about other measures that need to, you know, consistent to make this, you know, lockdown work, or, you know, or at least lessen those, you know, you know, negative impact and consequence that people have to face. And another case, I think that is not, this is the news about, you know, the the man who had the child is disabled. I think he has a Astin, you know, like they have like a mental health and mental illness. Since he was diagnosed of this disease, he was taken into hospital and get the treatment. But who take care of the kid? So the kid, I think after a few days, even the community workers didn't find, you know, there's in the desperate need help. So the kids died. So this is actually make people very angry, you know, because of the lack of the social welfare system that provide this, you know, needed service to address the needs of this family. Other case, for example, how you enforce this kind of measure, like when the social distancing and the lockdown was implemented, it was enforced that, you know, of course, it's Chinese people, you know, during the Chinese New Year, they join, you know, they get together and play mahjong. That was very, you know, popular game. But that's what violate this, you know, the social distancing or quarantine regulation. So people would, you know, break down their room, you know, break down their house, and, you know, like just using the violence. So this is the violation of the, you know, you can say this is a, you know, enforcement of the regulation or the policy. But on the other hand, this was people will criticize this kind of measure, you know, the implementation and enforcement as, you know, oh my goodness, there's a cultural revolutions coming back. You know, you break down somebody's house and, you know, you're impose, you know, those policies. That's scary. So the people actually worry at the beginning because of these cases happened. So, you know, the human rights and concerns and violation of the rights and all this, you know, the insufficient of the provision of the services is all, you know, big concern in parallel of this health, you know, public health concern. So this is I think this kind of concern and the criticism is very useful, is very, you know, very much needed, so that, you know, the policymakers and, you know, people who enforce this law will, you know, change their behavior and thinking more, you know, more comprehensively how to implement those measures that was, you know, unprecedentedly, you know, enforced because of this pandemic. Claire, I didn't see Claire.
Yeah, I think we just lost her momentarily.
Okay.
I think one of the features of being in the global south is having some sort of internet connection. So I think we can continue, Yiping, so we don't lose more time with the participants. I think we can pick up, I guess, from Claire's, from Claire's questions.
Okay. Yeah, Claire is back.
Oh, great.
I can't hear her.
You're on mute. She's on mute.
Oh,
yeah.
I think you need to unmute, Claire. Unmute. I can't hear you.
Okay, there we go.
Okay, great.
Oh, sorry, I'm such a novice at this. My apologies to everybody. Okay, so I was just, you probably have already answered it, Yiping, and if you have, I shouldn't go any further. Did you answer the question about, you know, whether or not that was fake news or whether or not it actually did happen, the barricading of people in their houses?
I don't know what's the specific, you know, the footage that you mentioned, because I'm not the one who are able to verify, you know, each of those, you know, the footage. But I do think there's a lot of fake news, of course, and there's also a lot of real news. You know, the accurate information has also, you know, been blocked because of the, you know, the concern about, you know, the you know, the social uprising, or the people, you know, would be, you know, feel, you know, the dissentence about, you know, those measures. However, I think we, as a citizen, should should be able to, to express our opinion. I think more and more people realize, how important to have this, this platform, this the space that people can express, their opinion and to exchange the information, because that's exactly what happened, when this Dr. Li, who disseminated the information in the social network, and he got a warning from the police, to be accused that he spread the rumors. But actually, in the end, after he died, and unfortunately he died of virus, and in the end, in April, he was announced as the, I think, one of the national hero or the martyr. That's actually in other way to trying to correct this this wrong. But we want to see it more systematically, not only on this single case. And this is and he's the microblog, even after his death, his blog is still ongoing. So the people are still go to write, leave a message, and write and report to him, what's going on. I had a good day, I had a bad day. So I think it's become a monument, that the people are trying to memorize him, but also as a way to claim, the space for the, the freedom of expression in that, in that way. Yeah, so sometimes I also, review his blog, and the people are, I think now it's a millions of, the text and, those and the notes after he passed away. So
yeah, no, that's
course,
very
yeah. So, but I would also like to add the one, where kind of, the playing the words, like in Chinese, that we always say, the 人权没了. 人权 means human rights, 没了 is the gone, the not exist. And there's another, the phrase also called 人权没了, means people or human being are all gone, disappear. So it's exactly the same pronunciation. So the people are saying, like, which you prioritize at this moment, particular moment, is a human rights or, the human existence. So it's making me reflect, rethink about, actually the long, just has been the long ongoing discourse, like the rights to development and versus human rights. For us, I think in Dawn we have discussed about, actually it should be conciliated. It was not really, either or, actually this is the both. So I think that is the Dawn has made very, very clear, this two shouldn't be, considered as the contradictory. Actually, it should be conciled because it's not like either or.
Yeah.
So
Thank
I think
you,
in this pandemic, that's exactly what's happened. Like human rights and and existence and the rights and the development should be give equal attention and priorities.
And it's good to know, Yiping, that there's been a very strong assertion of the right to know, the right to be informed, and the end of secrecy, and that so a very strong kind of demand, if you like, in terms of how people are reacting after this or during this epidemic as well as after it. Having said all of that, that China's maybe kind of not reacting at first in the way that it ought to have, but China did do incredibly well in preventing and controlling the spread of the virus and in treating those who are infected. I believe the percentage of those who recovered, the recovery rate was 94% at the end of May, according to official statistics. And it seems to have done very well with the enormous cooperation and even solidarity from its citizens. And, you know, despite not taking Dr. Lee's early warnings, you know, seriously, and in fact actually punishing him, it did swiftly recognize, or come to recognize, the enormity of the public health emergency it was facing, and it pulled out all the stops. This was seen in the rapid building of hospitals and outfitting of hospitals, and the fact that it marshaled 42,600, I think was the figure you gave, health personnel for Wuhan. These were both quite remarkable feats. And I understand that many of the doctors and nurses who went to Wuhan actually did so as volunteers. They volunteered to go. And, you know, they clearly rallied out of a sense of national duty, or out of a sense of, you know, the call of their profession to protect lives. As the global pandemic unfolded, what became clear was the importance of national public health systems and the importance of protecting medical workers who are at the front line of treating those who were infected through, you know, having PPEs or personal protective equipment. How well protected were China's frontline health workers? You know, the huge number of doctors that went to Wuhan. Were they well equipped with PPEs from the start? And was there any significant loss of life among China's healthcare workers from being, you know, exposed to the virus from treating patients? And what did the outbreak of COVID-19 reveal about the strengths and the weaknesses of China's public health system?
Yes, I think very sadly there's you know, the several cases that the health workers, especially in Wuhan, you know, before the announcement of the epidemic and the effective measures being taken, there's you know, quite, you know, big number of health workers and doctors, nurses are affected. And after the, you know, the measures being taken, you know, as you have said, there was a, you know, the teams from all over the country was deployed to Wuhan and the Hubei province, where the pandemic is, you know, severe. Actually, those, you know, the health personnel was okay. Most of them are actually, there was no single case if, you know, the infection. However, there was I think at least two cases. The nurses actually, you know, was the died after that. After they returned from Wuhan, I think it was out of the, you know, the exhaustion, or, you know, not from the infection itself. So I would say actually the protection the was quite impressive. You know, there's the PPE, there's all the supplies. Those, you know, Dr. Lee and the other health personnel, health workers, and doctor nurses were died is not because of lack of the, you know, protection measures. It's because of lack of the, you know, transparency, lack of, you know, that's I would say it was rather, you know, died of that, not from medical, more from the other, like political, you know, this insufficient reaction. So this is I think because of you know, China had this capacity to mobilize, you know, from the large scale, the all nationwide, you know, resources to fight against the you know, pandemic. That's why they have they are able to, you know, achieve this remarkable outcome. That's you know, to contain the virus rather quickly and reduce the, you know, the mortality rate to the very, you know, low level. So that is very impressive. Of course, you know, the women, especially, I think, has contributed a lot to this. I have some photos that I've shared. There's the nurses who are eating, you know, and she has been working in this, you know, in that clinic for 25 days, you know, after Chinese New Year. I haven't had a chance to go back to see their family. So when her husband know that she's actually fetching a patient just nearby nearby their compound, so they just run down to the on the street and to give her some Chinese dumplings, and then bring their 9 months son, because the son hadn't seen mom almost a month. So, and they have to keep like 1 meter distance when this women are eating the dumplings, when the husband and the kids have to stay away from 1 meter. So I think that's a lot of this kind of the stories that so I think the public health system is quite strong, especially in terms of the sexual and reproductive health, that's maternal health services. The Chinese government has invested quite a lot in the past 2 decades, trying to reduce maternal mortalities and other, and other disease. And they're trying to build this primary health, system. And so I think the public health system has played a key role in this, in dealing with the pandemic, because I think there was other the news report about the hospital that was a commercial, the private hospital. They also trying to contribute, and they said we want to be part of it. We want to contribute. However, what they can contribute, because they're the whole establishment actually was for the purpose of profit. So they don't have the equipment, they don't have the facilities, they don't have a trained, the house worker to dealing with this, because that's hospital was more, doing the plastic surgery, that kind of. So they have nothing to do, there's nothing they can contribute actually, even though they wanted to. So that's why I think people have really appreciate this, and they would actually reinforce this, this understanding of how important the public health. And also, if you have a strong primary care and the public health in the community level, the people don't need to go to the the central in the center of the of the city. Actually, that's make the where the better medical facilities are available. They can actually go to the local clinic and the community level. That's actually reduce the possibility of the infection and the spread of the disease. So unless we have that, actually we need the public health system, and even stronger one. And also we need really down to the community level, not to concentrate of this, resources only in the, that's few number of the, the good facilitated hospital and medical, medical institution. So that is yeah.
Yeah, thanks, Yiping. You said that COVID-19 has not been a great equalizer, as others have claimed, but has in fact exposed some of the many fault lines of inequality existing in China. And you've talked a bit about gender inequality. You didn't say anything about the burden of care that fell on women, particularly with the lockdown situation and the exposure to more domestic violence or gender-based violence in this context. So I wondered if you'd say something about that. And you've mentioned, how women health workers were really kind of expected to make the sacrifice, and they did. But I'm wondering too about the poor, lower income families with the economic lockdown, not being able to earn money. Did they have access to food, to all of the services that they needed, to supplies, to income support from the government in this time? Did China take action to protect its more vulnerable citizens, and is this likely to change, decrease inequalities in future? Will China take measures towards, ensuring that these vulnerabilities are lessened?
just this year, the 2020 is also the year that the Chinese government has set the target to, eliminate the extreme poverty in China. So this target hasn't been changed. So this, despite the devastating epidemic that's actually affecting this, how we can achieve this goal. But the goal is still, we're trying to meet this goal to eliminate extreme poverty by the end of 2020. However, of course, the inequality was the extreme poverty is the one. I think inequality is another concern because the impact of the COVID on the economic in the various levels, not only to the poorest and most vulnerable, it's also affected so-called the middle class, who has due to the lockdown and due to the virus, they are not able to maintain their work. They lost their job, or they lost income. So everyone affected, but I think with different in a different extent. I think the most affected are those who are working in the informal sectors, of course, because that's the job was just gone. Just give an example that since the policy, the quarantine policy and the lockdown and social distancing, like the workers can enter my compound. So those workers who are renovating the house, or to deliver the necessities, all these workers are not allowed to enter. And also you have to have this approved to show that you are renting apartment here, in that compound, unless your residence or your own the house here, you're not allowed to enter. So the people who are not able to afford the apartment, or not able to buy apartment, will not be able to to stay. So they have to go back to their home. So the migrant workers, the people who are working in the informal sectors, are affected the most. And those are, and also because of the the policies that actually they also hinder the transportation, and many of those the products cannot be transported to the market. So like especially those agriculture, the vegetables or this, they not be able to sell it, and especially if you're from Wuhan, so nobody dare to buy the product from Wuhan or from Hubei province. So that's become the problem. So even though there's no policy, but people just don't buy it. So the market actually has affected. That's why there's a campaign. I think government has a campaign that to encourage people to buy, via the e-commerce or whatever other means, to encourage people to buy, to support, the livelihood of the people who are most affected, which is the Wuhan and in Hubei province. But it's not only there. I think it is a nationwide, because of the the blockage, and because of the transportation or this regulations. It's very difficult for those logistics and the transportation. So, and also you can see that many of the activities now moving into online, like for example education. The primary school now have all this online course. But if you're living in the rural area, in the remote village, there's no internet, and you're not even able to to have possess a phone, have access to those those classes. So I think there was a case, the news report about the young girl, the girl in the Henan province attempted suicide because she had not able to afford a phone, and therefore she was not able to attend the class. Yeah, so there's many this kind of concern that like for example the people who from the Hebei province who owned a small grocery shop near my compound. This couple could not see their children. They have to leave behind the children in the village because of if they go back to see their children, they were not able to come back to Beijing, and they are not able to continue their job. Then they will lose their livelihood. So this, you can see the family are separated. Yeah, I think those rural and because of those, the global supply chain also affected severely. Those people who usually migrate to the other city to look for a job after Chinese New Year holiday, find out actually they were not able to find a job. They have to go back to their village. So a lot of this kind of stories. However, I also heard some other stories from others, friends who were working on the rural development project. And she told me she worked for this, the Rural Women Foundation. And she told me that in the past, when she visited village, they seldom see the young people because most of them are, migrant to the city and work there. And this time, when she visited the village in March and April, she found they're all back. They said, "Oh, this is maybe the good opportunity for us to, to implement our project in the village to, rebuild the community. Since now, those younger generations and young populations now return to their home, and they have cultivate, all this the field around their, the spot, a small plot of land, in their near their neighborhood, near the village." They said, "Oh, I've never seen this kind of, scenario in the last 10 years. So it's like what we see, in many places when the people, human beings are locked down, animals or this, are flourishing and they are more active. So we will try to find some, maybe the silver lining in this at the edge of this pandemic and see. Yeah, maybe we should think about, different lifestyle. I can't hear you. Maybe you should unmute.
Sorry. Yep. Sorry, Yiping. I said it's really very interesting too to see people, not just in China, but it's wonderful to hear your stories because it's happening in the Pacific as well. People becoming more self-sufficient, yeah, relying on planting food for their own consumption, yeah, and yeah, because of the necessity of having to do so. Let me just move on. There's been a great, there have been concerns raised about one of China's means of controlling the spread of the virus, and that is its introduction of electronic identification through facial recognition and contact tracking and tracing systems. You mentioned in your longer paper, everyone has to show your color code via your cell phone, which indicates your health status when you're entering and leaving premises. This technology, which you recognize as impressive in its efficiency, can be used for political purposes, as you well know. And it's surely an alarming step towards, you might call it absolute totalitarianism, allowing surveillance of citizens, facilitating search and arrest of activists, of dissidents, minorities that are perhaps not popular with the government. Has there been citizen resistance to the system, or is there general compliance? Is it even possible to resist? And are there more risks that this technology will be used against certain categories of citizens, vulnerable minorities who may be targeted for surveillance through these apps? And what are your views?
First of all, I want to show you how it looked like. This is my, the green code. It's with my and it's Alipay. Alipay, the app. When that you can, you have to, if you go to the, the market, you have to show this. How can I? Okay, so this see.
Yep, can see it.
Yeah, you can see. So it's green. So this is a green. Just like this become mandatory. So it's become a mandatory whenever you go to the like a public, like a restaurant, or you, I visit my friend living another, you know, the compound. You have to show this, and the board, of course, the transportation, like the, you know, the trains and the airplane, that you have to show this. So the technology, and in my compound, there was already installed this the facial you know, recognition device. Even though you wear a mask, then you still need to, you know, scan your face. Although I don't know how smart this machine, you know, can scan your face with a mask on. But anyway, this is actually the, you know, just you know, using this technology for you know, the data collection, surveillance, etc. It's not begin, you know, with the pandemic. It's not. It's actually, you know, has been for a while. But actually, I think definitely this pandemic has, you know, has you know, escalated and expeded, you know, this in terms of the pace and the scale, and how this, you know, being, you know, used. The latest case is that Beijing, in the last 7 days, last week, there's a new case in Beijing, more than 100 new cases. That's already, you know, confirmed cases in Beijing. And within you know, within the week, they have identified the people who had, you know, actually contacted, you know, with this confirmed case, or have been, you know, visiting those, the market, the one, you know, the market where the cases was identified. How many? More than 100,000 people were identified. Within, how they can do that is within this, you know, the data. So some, my friend told me that they receive a message, you know, on their phone saying that according to the big data, we noticed that you have visited this market in the last, you know, 2 weeks. So please go to your, you know, to register in the community and go for testing. So actually, that's, even though you may, I think one is that those technology or this so-called, you know, the data were not always accurate. You know, they might be, you know, they might be wrong. So that one of my friends said, I never been to that place, but, you know, I received it, you know, the message. And the second, my friend who has, you know, through this one of the, you know, the app from which you can get, you know, the green code so that you can travel, she had trying to fill out all this accurate information. Still, she could not get approval. So she was so frustrated because this is a machine. You cannot negotiate. You cannot, you know, they don't listen to you. So she was so frustrated. So, I mean, one is we not rely on this technology because technology is smarter than human being. It's not actually. They made mistake. And secondly, technology is not reliable because the human beings are so smart. They can, you know, do something to go, you know, away from this, you know, surveillance. For example, if you use the telephone for the, you know, as a device to, you know, for surveillance, the people have 2 phones. So when they travel, they use another local number, or they use the, you know, they borrow phone from others, so that you're not able to testing whether these people has visited those areas, that high risk area. So I think in that case, there was a confirmed the case actually delayed, you know, this diagnosis because of she actually hiding her itinerary. So that's actually through this trace of the, you know, of her travel didn't work. So anyway, despite of this, I think the major concern is, the more real concern is that how this system function. No information. It's just you have just accepted that, use it. You know, they applied, you know, imposed, just like that. So it was and secondly, you know, how they collect the information. There was no clear in the guidance or information about, you know, what you know, like what in what the, the extent that the information that you need to collect. For example, actually a lot of this, the data is collected not for the purpose of surveillance of the monitoring the disease, but for the profit making. One of the case that my friend shared with me, she's tech savvy. She told me that in her compound, they were asked to log on to download the app and provide all this information and register in order to get into their own home, because in your entrance you have to show this, and she just refused to provide those information, and she argued and she complained to this and asked, show me the policy or any document that authorize you to do that, because this is the maintenance office of this compound actually imposed this, and they didn't give any the authorization. And also I think she said is what worried her is that the information they collected is more than they should, like where you have been. It's about your personal, like your personal health. So those information they collected can use by those private the business, the corporations, to further to target you when they're selling something to you, or your that's for the profit making purpose. So it's not for the public health purpose. So people maybe can understand and accept and concede to this public health concerns. For this purpose you're collecting this information that I can submit it, but but in many cases actually that's what's not the case. It's just the purpose of the profit making actually is a real motivation for that data collection. And also because of the platform they use, they actually is very monopolized. All this information's the platform, like for example this coding system was all through either the big telecom or the the Alibaba, the companies, or very few companies actually multiplied all this data collection and data cultivating. So that is also actually strengthening this the multiply and also exposed to the subject to the further multiplication of those data. So this is a worry. But I think a lot of education need to be done, because not everyone realize this. But what I would want to say is actually it's not only China now using this measure. It's, if you look at in many Eastern Asian countries, now I also heard about, UK actually now apply this big data as a way of the surveillance of the, the disease. So I think this is a global issue.
Thank you, Yiping. We see the multiple uses of this, yeah, and the political uses, if you like them, well, equally sinister to the profit-making motivation or uses to which this can be put. Yeah, I've got a couple more questions. I don't know how we're going for time, because we do want to leave some time for hearing questions that might be put forward by the panelists. MG, how are we going?
Yeah, so because we started a little late, we have another 5 minutes if you have a last question, Claire,
okay.
and then we can move to the participants' questions.
Okay, well, I'll just go to the last question that I had, which is really, and thank you, Yiping, it's been a very interesting conversation and really giving us so much more of an understanding of what has happened and what was happening in China right from the start until the present time. We could go on, but we want to leave some time for the participant listeners. So the last questions, bearing in mind the reported resurgence of COVID-19 cases just this week in Beijing and elsewhere, and an earlier spike in cases in Wuhan, do you think China may be moving too quickly to reopen its economy? And are there things that the Chinese government and Chinese people may have learned from this pandemic? in countries which have been very reliant on the Chinese economy, China as a kind of global, what do you say, factory, there's talk about reducing dependence on China by reshoring production. So I have a question: how would reshoring, if it came to that, impact on women workers? And it's not a related question, but also, are there things that China, the Chinese government and Chinese people maybe have learned about, for instance, wet markets, as in, you know, considering going forward whether or not control or regulation of wet markets is something that might be very necessary? So it's just, yeah, two questions that are not really related, but related to what are the, if you like, the learnings from this for both China and Chinese people.
Yes, I think we are learning by doing. I think that's the only way that we learn. And in case of the pandemic, I think it's more real, you know, for this, you know, you learn while you're doing. I think we also need to be very honest about, you know, how little we know about this virus. So any measures that we're taking, either, you know, policymakers or our personal individual, this is actually just testing. We don't know whether it's effective or not. And for example, that, you know, at the very beginning when this breakout, that, you know, Chinese and also the Eastern Asian countries where they are affected the first start to wear the mask. And this we consider as, you know, bad. You know, they can be discriminated against, you know, when they're doing it in elsewhere. And now even, you know, the scientists and every nation now recognize the facial mask is very efficient protective measure. So, you know, that is the process that the people learn, you know, from their mistake. If they have done this earlier, maybe they can reduce, you know, the infection, and maybe those pandemic would has, you know, devastating as it is now. So I think, yeah, as you said, you know, we only learn from our mistake. So maybe we haven't learned enough because we haven't made enough mistake. So this is my suspicion. So I think we need also to be really, really honest about, you know, our, you know, ignorance and our lack of knowledge. Not pretend that we know, you know, how it, you know, what is a virus, what is, you know, the cure of this medication, the vaccine. It will take a, you know, much longer time than we anticipated. So we need to have more patience. So I think other than that, I think what, if I can say, you know, what does, you know, Chinese people learn, government are learning, is that they are trying at least some, you know, good sign that in the past, the Chinese economy is always like GDP growth oriented. And this year in the National Assembly, the Prime Minister said, we're not setting any target on the GDP growth this year. So I think this is good, you know, that they admitted that they should stop this kind of, you know, way of thinking of, you know, that GDP is the most wanted, that's most important. And secondly, I think in the past, there were very, you know, strict regulation on the, you know, like street vendor, because that was considered as, you know, destroy the environment, was not well regulated. You know, there was a lot of, you know, concern about, you know, street vendor, you know, the wanderer. And now because of the COVID, many people lost their livelihood. So some government in provincial level start to, you know, allow people to selling stuff on the street. Whatever you can do to make money, make a living at this difficult time, it's okay. So we're not, punishing you for this. So that's become, the new, so that people start to change shifting their thinking, which is a positive sign. However, I think as a country as big as China, there's no one size fits all measure or solution. The same as the global level. There's each country has to find their own way to cope with this pandemic. But at least we should be more open-minded. And also, I think it's important, that's from my own travel experience during this pandemic, going to abroad and come back to China. That's, the solidarity and the sympathy is also very important, because that is not only, in the moral sense, it's also a very important measure to contain the virus spread. When you're, sympathetic, when you're in solidarity with others, actually you take more responsibility. But what I say is, I also put in my article that how I see like a very common people in China that's what's actually implementing those policies. If they are doing their job, with more, like respect, with more sympathy, with more solidarity, they can make a difference, and people will actually build more connections, and will build more trust. That solidarity, that trust, that connection will, contain the virus spreading. So that's how I feel like, because when I traveled back from Spain, back to China in late March, I feel like I was considered as a virus, of course, imported virus back to the country. But when I encounter those people, the house workers, the CDC people, and even the local police and local community workers, they all, like very understanding, and they're all, very kind. So I feel much better, like they treat you as a human being, not a virus. Now, of course, I have submitted all my information as required, and those people, I've never met her, but she always like text me and said, how are you, how you feel? And I'm so happy that you're finally back home safely. So, this kind of words like really make my, like release my, my nerves.
Anxiety.
Yes. So I feel like, and also the people who work in my compound, the guard, they have been working there since January, and like 10 degree minus 10 degree outside, outside now it's the 35 degree, above zero. So you can imagine that they wear masks like several hours a day, and just to checking people's, the code and whatever, their pass. So if we give more respect, to trying to be cooperate with them, I think it's not because I hate, this is all these measures, just because I respect the people who are doing their job and trying to do the good for the other people. So and they are very polite, they're very patient. So I feel like we're now trying to build this, rebuild this connection, because in the past they're just a guard. I'm the owner of this, of this apartment. So I have rights, I have all this privilege, and they're just a guard. And now we feel like, we should support each other. So that's the human connections that we're trying to build. I think there's something that the pandemic and trying to teach us.
Okay, thank you, Yiping. We've got a number of questions, so we should go on to that. And because we don't have a huge amount of time left, maybe they can be short answers, Yiping. One of them from Sophia Shrek. She says, a positive thing about the pandemic is that it reduces the carbon footprint and pollution. And it's kind of related to the question about, if China stops being a global factory, this may have some good impacts. Yeah. in that respect. But Sophia's question is, I'd like to ask Yiping, what do you think about the Chinese role so far in terms of providing support, including sending public doctors to train local doctors in other countries, including Cambodia? And I think she makes reference to providing PPEs and military trucks. Does that sound right? Should I just go through all the questions and then you can answer
I think
No?
maybe
One at a time.
Yeah,
okay, but just try and keep the answers short, because you won't then be able to fit them in. Yeah.
Yeah. Okay. So I think the first question about the carbon
Footprint.
emission. I think the pandemic is as I said, is an accelerator because China has already put in the very high agenda of the so-called the green growth. At least that's that's the big concern. It's already started, trying to reduce and make a commitment and pledge to the Paris Agreement, etc., etc. So this is I think this pandemic will really, accelerate this process. I hope. At least there's some actions as a measure has already been taken. Like I think in the last month during the National Assembly, the law on the protection of a prohibition of any use of the wild animals that been adopted. This is a new law, so they're going to enforce this new law. So there's no any even like the people are asking, what if I raise the wild animal in the farm? That's considered a wild animal, or I still evaluate the law. So I think now the answer is that no more any species of the wild animals allowed for trading or for any use of purpose. So this is at least something positive. As for the second question by Sophie on the support, China has I think there was just yesterday China had organized the global summit, China's African summit on the combating the COVID. That's co-organized by Chinese government and South Africa government. So I think the main, of course, the main agenda of this summit is on the international cooperation and to combat this. China also has, I think, according to their official report, they have provide aid to more than 70. I can't remember the number. The countries all over the world. Of course, they have their own the list of the priorities. So those countries who had, of course, have a close relation. Sorry, let me. Sorry, that's my radio. So that is I think they will continue. I think they have sent the doctors to Italy, to many, and Ethiopia, all those countries who had a quite close relationship and friendly relationship with China. But I think this international, especially the health collaboration, has already been going on, I think, for a decade. So that's I think my answer is yes. Definitely, and China should take more responsibility, and if they have the capacity to do so.
Mm-hmm. Yeah. Yep. Yiping, there's a question. There are a couple of questions about domestic violence or violence against women. Please tell us how, this is from Usha Chandran. Please tell us how, according to you, has the virus scare as well as the lockdown affected women more than men? It's not just about violence. And then there are a couple of questions from Govind. Hi, Govind, Kelka. Hi, Yiping. I wanted to know reasons for domestic violence and what special measures, this is from Shanta Shrestha, what special measures have been put in place to protect women from violence and enjoy SRHR?
Mm-hmm. Yeah.
If
I
you want to
think
just answer those, yeah.
yes. On domestic violence issue, China has a anti-domestic violence law that's since 2015. However, the implementation and enforcement was not satisfactory, as we can imagine. I think there was a case during the COVID. I think the cases gave more attention, and one is that and according to the report of the local service providers, there was an increased number, definitely. But it's not only on the violence in domestic violence law in China. It's not only protect the women or the spouse, the being treated violently, but also include the children and elderly people. So actually, because of the lockdown and because of the people's stress, the case actually the number is increased. However, we don't have a very good the system for the data collecting, so we still lack of this accurate number and what exactly. So the number that I mentioned was the from the local, the service provider in the Hubei province, in the one city in Hubei province. It cannot be representative, example of the nationwide. And also we have seen many cases like the violence against, of course, the women, but also on the children and the elderly people. They also experience the domestic violence during this time and have a very, little support, because the children, since now they're being always at home, so actually they're exposed to the more the bad temper of their parents, and which is also frustrated. Yeah, so this is for the SRHR. There's at the beginning, this all this other medical treatment was put aside, because now the concentrate on the only COVID, and that's being criticized, because the people with HIV/AIDS, they need medication. The people with non-communicable disease, and they need treatment, they need medication, and they cannot get any treatment and any medication. So let alone the SRHR. And so the people who, for example, the women, the pregnant women, the women who are going to deliver in the hospital, find out actually all the hospital in Wuhan was now, only receive the patients that need treatment from the COVID. So, but this would soon change, because of the peak of the cases, when the curve flattened, and all this other, the medical services provision has resumed. So now I think it seems okay. That's the one thing I want to mention. Is interesting that actually the sexuality education programs during the COVID is booming, because now a lot of the online lectures, online courses offered. Most of them are, of course, for the educators, and the school teachers and the sexual education, the facilitators, and for the parents. So this is interesting, during this lockdown and during this, actually, there was a reaching the audience that's much more than when they're, those education was only happened in school. So now the people are more open to the sexuality education. That is one. Also, I think the reason is because of the several sexual assault, sexual violence cases that's, on children. So that make the parents is more sensitive and more willing to open to this kind of education. So that is yeah. So this is another. So I heard that like one online course has actually has received several 100,000 audience. So that's
Yiping, I have one more question because we're getting to the end.
yes.
The US and others are blaming China for not revealing the problem sooner and pressuring the WHO. Is there discussion about this inside China?
Yeah, definitely. I think this has become a really actually the headline news of the international media. I also lately had because my background is history, so I have read some books and listened to the lecture on the Black Death in the medieval age. So what I found was very interesting. I think when it's this is more like a, I don't know how much this is really covered, capture the truth, but I think there's a U.S. and China tension and blaming and goatscaping. It's not something new. It's always like that because of the political tension that's already there, over the trade and etc. But what I found is actually whenever there's a something devastating disaster happen, and the people are shocked, your first reaction very naturally is to deny it. That's what the government does here. And the second reaction is you blame others. So this is a very natural. As the US blame China, and China also, like you can hear from the Chinese Ministry of Foreign Affairs, the spokesperson, like also accuse, the US, which none of them I see at any scientific ground. So I don't think I have all this information to make judgment, which blame is have evidence ground. However, what I see is that this very much this political driven, political agenda driven, that's blaming would really destroy some basic trust, and also destroy this, make it impossible for this international cooperation and that solidarity that's definitely the need at this moment, make it impossible. And this was very different from from the 2008 when this financial crisis outbreak, when China and the US actually worked very closely at that time. I was just trying to understand what's this, why we have to face the this situation now, instead of the international solidarity that we're now enter this this era that this two important power that should work hand in hand, actually they're blaming each other and make it this things worse. But I would just want to say that actually in medieval, and from the reading that the books that I read in the medieval times, when there's a Black Death breakout, the pandemic breakout at the time, I think it's very easy to understand who is being blamed is the Jewish community. And they're blame them for for poisoning the well, the water sources in the city. And I think the one city in France that they have killed 9,000, I think 900, I can't remember the figure. They killed the whole entire Jewish community in the town, even before the pandemic, the Black Death arrived. So you can imagine, I'm not saying, if China or who else should be blamed. I just want to really actually draw our attention to, when they look at who are being blamed, there was always people are blamed, the migrant worker. There's, Asian people, Asian looked people, if you are going to the Europe or the US. There's, the people with different, like a gay community in South Korea, they always someone that, in this society are blamed for bringing the disease. The poor people, they're blamed because, they go on the street and wandering, so they are like spread the disease. and the women, because they are working inside the home, so they bring so this kind of blaming has been always ongoing. So let's draw our attention to, who are the ones who being blamed. It's always a good, indication, and who are at the bottom of this hierarchy, who are the most vulnerable, who are, so that's something that I learned from the history and also from this pandemic. But yeah, I think there was another thing is interesting, like when China trying to defend itself, then they're trying to concentrate on their, dealing their own domestic problem, which is also remind me that because of maybe they're not having this pressure of the, electoral, the politics, so that they don't have to worry about, to shun the blame to others, so they can concentrate on the work that need to be done. Because blaming each other, blaming others won't help you to protect your people, to, to build your economy, to address this problem. So that's, so I think that game should stop. And I also really looking forward to the scientific, evidence, that not for us to blame someone, but for us to understand what's going on and trying to prevent this kind of devastating pandemic from happening in the future, or at least, reduce this the devastating impact.
Thank you very much, Yiping. That I really think that those were excellent words to end the session with, and I particularly wanted that question to be answered because it was the one I skipped over. And what you've pointed out is a pattern in these sorts of things, that humans tend to find some kind of scapegoat for something they maybe don't understand. But it is really irresponsible when there's a political leader who actually, begins calling it the Chinese virus, and very deliberately. And that sort of thing. I mean, I was going to ask you about, the impact of that kind of scapegoating, because it's very political, it's very irresponsible, and it could, have some pretty awful consequences. And so you remind us of historically what has happened before, and I thank you for that, because we want to live as responsible human beings in this world, and blaming doesn't, as you say, help us deal with this virus, which hasn't ended, and which we may be finding ourselves living with for some years. I think
it takes 300 years in the medieval time.
Yeah, well, hopefully not with modern medicine. We hope that we will have a immunization soon from this. But yep, MG's giving me the sign.
I'm crossing my fingers, like hopefully.
Hopefully.
Don't worry, that was not the pattern. There was like they're coming back, after 10, 20 years. So there was so that's the pattern. So don't worry. We will only leave one, not the second one. That will be our next generations.
Yeah, I want to thank you, Yiping. That was such a rich session. As I said, it was a privilege to actually have the conversation with you. And I want to thank all of the participants. And I'm really sorry that we couldn't answer more of your questions. Thank you all, and have a good evening. It's evening here anyway. Good day, wherever you are in the other parts of the world. Yeah, thank you for joining us. And I hope you'll join us for the 3 other dawn talks in this series. Yeah, thank you very much, and thank you.
Thank you, Claire.
To
thank
our
you,
comms team. Thank you to MG.
Thank you,
love you too. Bye.
Thank you for
care, my friends.
Thanks everyone for staying. Bye bye.
Thank you. Bye bye.
Bye.